In some parts of Nyagatare District, especially in the commercial centers of some of the rural sectors, there are a significant number of residents that do not comply with the guidelines set to fight against COVID-19, including properly wearing face masks. In the centers, you will find hand-washing stations that look to be abandoned and unused. Those who remember to wash their hands when they come to seek services are few. This is one of the reasons why local residents of the district confirm that the number of people infected with the virus is increasing. There are times when people forget to follow the guidelines. Someone will come and chase us to remind us to put on face masks, as well as follow the other guidelines. But people do not give it any importance. They're doing what they feel like. There is a need for people to wake up because if they remove the lockdown, some people may feel like COVID-19 no longer exists. According to the daily statistics released by the Ministry of Health, the number of people living with COVID-19 in Nyagatare District is estimated to have reached 904 people this August. According to the Nyagatare Hospital Administration, Nyagatare sector is at the forefront of having the highest number of patients, followed by Rukomo, Mimuli, and Karangazi sectors. Nyagatare District's Deputy Mayor for Social Affairs said that one of the reasons for the increase in the number of people infected with COVID-19 was the fact that some people were hiding that they were positive for COVID-19 and not following the instructions to stay at home. There were also people that confused the virus for other diseases. One thing we can see in the villages is that people are getting infected with COVID-19 but confusing it for other illnesses. That is one of the problems we found. One may come to the doctor with shortness of breath, and that's when they'll get tested. He or she will attest to the fact that they thought they only had flu, and that was what caused the shortness of breath. A person will also go on to say they thought it was a different illness or even malaria. This is always based on a feeling without testing. We are continuing to spread the reminder that all residents should be cautious and take advantage of the clinics near them for testing so they may know where they stand. COVID-19 infections in Nyagatare District are currently at a rate of 17.8%. This led to the decisions of the cabinet meeting held on September 1st, 2021. Special hours were set for Nyagatare, Burera, Gicumbi, Goma, Kirehe, Rwamagana, Nyaruguru, Nyamasheke for residents to reach their homes because they showed higher numbers of COVID-19 infections. According to the Minister of Local Government, the districts should already be under a total lockdown, but they are being given the final opportunity to turn things around.
The
district of Nyagatare has an infection rate of 17.8%, while Gicumbi is at 17.1%, as well as these other districts which have respectively 11%, 10%, 7.8%, 7.2%, and all these figures were recently confirmed. But there are other localities where the infection rate has been observed to change, such as Kigali City with 0.8%. Early curfew hours have been enforced as a way of allowing people to work, otherwise they would be in a total lockdown.
Meanwhile, the COVID-19 vaccination campaign in Nyagatare District and across the country has continued, but the Ministry of Health says the districts with higher numbers of infected COVID-19 residents will be prioritized. The ministry also said there is confidence that 2021 will end with 30% of Rwandans vaccinated and an expected 60% of Rwandans will be vaccinated by 2021. Umwali Jade, RTV News.